can they project my presentation? So I'll try to be quick because what I'm about to say, you probably heard it many times before. You know, I come to these sessions here and here, keep saying the same thing. The question is, what have we accomplished? But while the slide is coming up, can I ask how many people in this room have health insurance? Okay, I can barely, I can count on two hands. And I don't want to ask why, but we'll get to it. The second question I want to ask is, with a show of hands, how many people are happy that President Donald Trump shut down USAID? So all of us are independent, we love aid. Anyway, I'll reserve my own comments. So I'll quickly run through the slides. Some of the content has already been communicated. Again, I'm Ndili. Now I'm wearing the hat of Country Director of Pharma Foundation. Next slide. So, universal health coverage. My topic really is, how do we blend innovative financing with insurance to achieve UHC? First of all, we know what UHC is. And by the way, we keep talking about UHC 2030. We're 5 years away from the target, which is 2030. And I can guarantee you that we will not achieve UHC for so many reasons. But we'll keep working at it. So basically, it's access, quality, and financial risk. A lot of this stuff you should know, and I'll also make these slides available. Now, just to go back, Nigeria has gone through quite a number of iterations over the years, trying to get to the destination of UHC, putting in the building blocks. So you can see the progress that has been made over the years, from when the law was enacted, to formal sector inclusion, to National Health Act, Lagos State also, unfortunately the commissioner wasn't here today, being the first to enact the health insurance law, to BHCBF, and so on and so forth. A lot has been done, but what is the percentage of people covered by health insurance in Nigeria? Does anybody know? I think we're currently less than 10%. So again, 10% of 200 million people is a lot of people that are not covered by health insurance. And I'll tell you a real life story. Just about 2 weeks ago, I had an incident with my domestic staff. Around 7 p.m. in the evening. It was so bad that I had to rush. In fact, it was on the day after my award and transition to president of the Healthcare Federation. So I live on the Lekki axis towards Chevron. I started looking for an emergency room where I could take her to. The first one I saw was, and I'll say the name of the hospital, it was Peninsula Hospital. Those who are on the Lekki Road will know. I drove in there. As we were driving in there, I said, this can't be a hospital. But they said, well, it had a big red sign. So anyway, we drove in there. But first of all, the first thing I saw was a spiral staircase going up to the first floor of the building. I said, are you sure this is a hospital? I said, it's a hospital. I went, because in my head, I'm like, how do we take her up the staircase? But I said, let me go and inspect myself. By the time I got in there, of course, this was about 8 p.m. There was nobody. I looked through the window. There was a settee. I knocked, nobody opened. I said, this is not a hospital. I got back in the car. My husband was driving. We went to BGC, CRI. We got there. I was a young doctor. Emergency. Said, I'm sorry, I can't take care of her. I'm not equipped to take care of her. So I got back in the car. The only option I had was to drive to Pelham Memorial, which is a safe care level 4-5 clinic of Pharma access. And that's where she was admitted right away. And funny enough, as we were driving to Pelham, my husband looked at me and said, you're president of nothing. The point being that we don't have a healthcare system that works for everybody. If I didn't know Pelham and hadn't supported them in their quality journey, I wouldn't have had a clue where to go. Again, this is why I love the hat of the Healthcare Federation that I'm wearing, because really we need to do something about private sector. But having said that, you can see Dr. Moore talked about this, the expenditure on health. You can see Nigeria, we're still out of pocket over 76%. If I go to the next slide, you can see the expenditure on health compared to the rest of the other tracks. You can see security, it took half of the pie. Education took another half, but you can see how small the health expenditure, the budget release is. So again, this is nowhere near the 15% we keep talking about decades and decades ago. So, it's a problem that we have to face, that if any of us falls ill in this country, the supply side is not ready to take care of it. So what are we doing about it? When you talk about UAC, there's so many different factors that apply for you to achieve that, and this has been tried and tested in many countries. I don't need to go over that. The economics and societal factors, policy implementation, all of this put together. But the most important thing is that government has a huge role to play. We ask the what? Government, they need to set the priorities and everybody aligns behind them. In the past, it was the donors help set the priorities, then the government aligns behind them. Am I correct? But it's changing now. So everybody has a role to play. Why do we have to do that? Again, we keep emphasizing private sector, private sector. Private sector, this whole exhibition is private sector. Of course, there are a few regulators in here, but it's really private sector setting up the stands and doing work, which we must support. I don't want to go over this. Everybody has a role to play. What do we need to do? But it's important to also note that in as much as private sector has the capacity, the innovation, the capital, and so on and so forth, they need to support government. Oftentimes, we focus on, we make all these policies, insurance, demand-side financing, and so on and so forth, but we forget that people buy insurance because they trust in a system that will deliver care when they need it. The reason why a lot of you will not buy health insurance is because you don't trust that the day you fall ill, that you walk into a hospital and receive care, just like I experienced, even though I have insurance. But the fact that there's emergency covered, and I couldn't get emergency anyway. It was a life-threatening condition, the lady would have been dead. And that's the situation we're in. So as Pharma Access, this is the model we work with. We operate across the entire ecosystem, focusing on demand side, supply side, governance, so we build capacity and so on. Then also, the patient has a responsibility of behavioral change, taking care of yourself first. And I'm happy to say that Nigerians now, you see all of us running on the street, everybody's very healthy. That's the starting point, then the environment and so on and so forth. So what do? We try to develop innovations that will support all the different tracks that we've identified. Right now, healthcare is considered as high risk in the banking and finance sector. Why? Because if something breaks down, the first thing here, I don't want to go and carry the machine because it will look somehow. They don't even understand healthcare, much less how to begin to intervene and lend and so on and so forth. But at the same time, the business owners also don't understand that healthcare is a business. So when you're setting up your organization, the supply side, you need to make sure that you have the right governance structure, the right accounting system, and so on and so forth, so that you run it as a business, you're able to take a loan, and that way you can expand and grow. So this is just an overview. I don't want to go into all of this because it will take the whole day. Some of the challenges, that access to finance, which I talked about. I don't know how many health SMEs will go to a bank and get a loan. You won't get a loan because you don't have audited financials. You won't get a loan because the owner is the receptionist and the anesthesiologist. You don't get a loan because you don't have transparency in the use of funding. When you get money from a patient, you take from that money and buy lunch, and you don't deposit it and so on and so on. So there are things that banks look out for you to be able to access credit. But even at that, even had all that in place. Banks are a bit reluctant to lend because they don't understand the healthcare business. So these are some of the issues that we need to sort out. Insufficient domestic health investments, fragmented healthcare private sector, which is what we are trying as HFN to aggregate and make sure that we are aligned. Lack of health SMEs with specific financial products. In the past, through our medical credit fund, we tried to develop a few of those with some of the banks, but even at that, it was still a problem. Then, of course, high out-of-pocket expenditure. Then when you talk about the strategic pillars, what do we need to now start focusing on to generate funding for our health system? The local resource mobilization. You can see some of the bullet points underneath, and I'll focus on the syntax, because as HFN, we advocated for the syntax, which is sweetened sugar, alcohol tax, SSB tax. And yes, we got it approved, but guess what? It went into the kitty of the government. So all of a sudden, all the work we did has gone into the aggregated pot of financing of the federal government and not ring-fenced for health. So, they said, well, there are other priority areas, so healthcare should take a back seat. So there we are. Then you talk about insurance. How do we expand insurance? What is a chicken and an egg situation? Because you can't expand insurance when people don't trust the hospitals that they can go to. Public-private integration. I'm happy Dr. Omo mentioned that, because there's no minister of public sector, minister of health for public sector, minister of health for public and private. And the more we get that into the psyche, the private sector is actually part of the ecosystem, the better for us. Innovative financing models and so on and so forth. I don't want to dwell too much on that. Now let me go back one slide just to say that there are some examples of loans. We advocated for some kind of intervention fund in the healthcare sector. It's funny because some of these requests get approved and yet you can't access them. They said there's a fund for health sector, but only the big farmers will access those, but the small SMEs will not. Private sector investment is quite a bit of that. Grants and insurance reimbursement. This also helps the private sector when, or rather, puts money into the sector when they are being used from capitation and fee-for-service. Now, I want to give you an example. This is just based on the work that Pharma has done. Just to give you an example, because oftentimes, we hear a lot of theory, but I think that we need to begin to take a step into doing practical activities, no matter how small. At the end of the day, it aggregates. So I'll use this as an example, and I'll quickly end after that. One is the Global Fund partnership for TB and HIV/AIDS eradication that we partnered in Lagos to do. Initially, Global Fund is it's a very old developmental agency that focuses specifically on how it does business. But we said to them, listen, it's cheaper for you to cover health insurance for an individual than to continue to replicate structures all over the place. CD4 count machine here and there. You put an individual there. Can you begin to think about how you can cover insurance for an indigent rather than just paying for HIV/AIDS treatment? Because after all, it's one person. Cover the whole person as opposed to a disease ailment. And I must say that after years and years of advocacy and work, that this has now started in Lagos and Kwara State, where Global Fund is now going to pay for insurance for indigents. That's an example because they're putting money into a collective government kitty. That is blending the finance, if we call it that, on the supply side. Then the access to finance, Dr. Omo also mentioned that this is where private sector is running non-functional PHCs together with HFN, who was the aggregator. And I can tell you, and he can also speak for himself, but you should talk to him later because you're running 5 facilities in Delta State. Of those 5 facilities, there are about 8 other HFN providers that are running healthcare facilities in Delta State. And in the period that they've been running, there has not been one single maternal mortality in any of those clinics. It sounds unbelievable, but it's true, because we've done an impact evaluation looking at the PPP in access to finance and those run by the state, and the difference is staggering. So we've taken this up and made all sorts of presentations. Again, it's how do you scale up. Para State, we've done quite a bit there, which is where health insurance actually started, to show that health insurance must be mandatory, it's not optional for it to have impact. And then PPP in public facility, Ibobi Hospital in Lagos here, together with Pharma, MCF and Grofin, we put an MRI CT scan inside Ibobi, which didn't have any at all. So you can imagine somebody has an accident, they have to carry in an ambulance outside the facility. You can do an X-ray before you come back, CT or MRI before you come back. So that now is an example of a PPP in a tertiary institution. The InterSwitch, some of you may have heard of it, the switch that is trying to digitize Lagos State, and so on and so forth. So the point is that there are actually examples, and by the time we begin to aggregate all these examples, we can have the proper support of private sector working together with governments to improve our supply side. Now, these are just recommendations of what to do: increase insurance, regulation, digital platforms, very important. Again, one of my favorite lines is that we will not achieve universal health coverage if we don't leverage digital or mobile technology. Everybody here has a phone. Your phone has the capacity to connect you to a healthcare facility, just like Uber. So how do we leverage on that? And I'm glad the current administration is looking seriously into digitizing the healthcare sector. Public-private integration, tax incentives. So to conclude, I'm just highlighting some of the points I made earlier. One is, how do we blend finance and insurance to ensure that there's sustainability, especially for the SMEs, which is where most of us go to. We don't go to the big hospitals, we go to the smaller ones. Regulatory shift, which is where HFN is really pushing. We're pushing a lot of policy changes in favor of the private sector, and I have to be thankful that the government is listening. Public-private integration, and then of course leveraging digital to unlock new financing models. Having said that, I'll then end with just this slide, which is a market study that Pharma had done with the support of the Ministry of Foreign Affairs of the Netherlands, just showing investment areas in our healthcare sector that can attract investments from either within or from outside the country. Healthcare is a business, and if you invest in healthcare, you see the effects. According to McKinsey report, for every $1 invested in health, you get $2 to $4 return on investment. Thank you very much.